Hello, I'm Peter Brownson. I'm a consultant orthopaedic surgeon at the Bone and Joint Centre in Spire, Liverpool Hospital. And I'm here today to talk to you about the common shoulder and elbow complaints which I see, how they can be diagnosed and more importantly, how they can be treated. My career path in orthopaedic surgery has taken me to some of the leading shoulder and elbow clinics in the world. And in this country, I've had the privilege of working with some of the best shoulder and elbow surgeons this country has to offer. My aim at the Bone and Joint Centre is to provide you with the best, most up-to-date diagnosis and treatment for any shoulder and elbow problems which you may have. The shoulder and elbow are relatively complex joints, and as such, if problems can be diagnosed early, then usually the treatment is simplified. What are the common shoulder and elbow problems that I see? Well, when a patient comes with a shoulder problem, I get a good idea as to what the underlying issue might be once I know their age. Younger patients, and by younger patients I mean those under the age of 35 years, will usually have an instability problem. In its most obvious form, that might be that they've had a true shoulder dislocation. But in the more subtle forms of instability, they may have pain, particularly associated with certain positions, or if they're an overhead athlete, with throwing or with serving when they're playing tennis. If those problems can be diagnosed early, they'll usually respond to physiotherapy. If not, they may need imaging with some scans, and if there's structural damage to the shoulder joint, they may need a keyhole procedure to repair that damage. And those keyhole procedures carry an excellent outcome with 80 or 90% success rates. In the middle years, patients have one of two problems. The commonest problem is an impingement syndrome. An impingement syndrome is due to inflammation within the tendons around the shoulder. Patients get pain, typically when they take their arm overhead or when they reach behind their back. If the problem can be diagnosed early, it will respond to physiotherapy and possibly an injection around the shoulder area. Later on, when the changes become established, a simple day case decompression procedure will carry an excellent outcome with 80 or 90% of patients returning to normal function within a matter of weeks. The other diagnosis that occurs in those middle years, and by middle years I'm thinking 30 to 60, is a frozen shoulder. Frozen shoulder is overdiagnosed as a condition, but it is extremely common in diabetic patients. Patients get pain and then they get stiffness. If you can get to the problem before the stiffness becomes established, it may respond to a combination of physiotherapy and injection treatment. But if the stiffness becomes established, then a day case keyhole shoulder release procedure is an excellent alternative, returning 80 to 90% of patients to normal function within a matter of weeks to a couple of months. In the older age group, and we're thinking about patients over the age of 60 years here, they will have one of two problems. They may have a tear within the tendons around the shoulder, the same tendons that were affected by the impingement syndrome earlier in life. If those tears can be repaired before they become too large, and that's again a keyhole procedure, then that's an excellent alternative. The other problem which that older group suffer from is arthritis within the shoulder joint. It's not as common as occurs in the hip and the knee, but when it does occur, as in the hip and the knee, a shoulder replacement operation is a good option. In terms of elbow problems, by far the commonest thing that I see is a tennis elbow syndrome. It affects people in their middle years, they get pain on the outside of the elbow, and it will respond usually to a combination of physiotherapy and injection treatment. The Bone and Joint Centre is a modern, purpose-built facility within Spire, Liverpool Hospital. We provide comprehensive inpatient and outpatient treatment for all common orthopaedic conditions. If you think you're suffering from any of the conditions that I've been discussing, then please visit the website for more information, or alternatively book an appointment, and I'd love to see you in Liverpool.